And with the health insurance, it's actually very different because you have two programs, two prices, right? Like the classic program and the global program. The classic is the one that I have. It's actually very good. If you need a specialist just because you want, people always say like, I need someone for my colon.
Yes.
How do you know your colon? Are you a doctor or something? No, I just know. I just know it's my colon.
I know it.
I need someone, a specialist for my colon. Then you just go to the app, to the Sura app, if you actually have the insurance, and you can download this medical directory. It's good because if you're a doctor and you actually got into the Sura's directory, and we were talking about Sura, right? Because I think there's only two companies that offer health insurance,
right?
Sura and Bolivar.
Yes.
Bolivar is a very good insurance company. I also work with Bolivar, but in the health, is not. I don't think it has like all the tentacles that Sura has.
It's not as like comprehensive.
Exactly. So, and Sura has like 3 clinics here in Medellin just for health insurance.
Okay. So, wow, I didn't know that.
And they're very good. Yeah. You have one kind of near Industriales, and the other one is Sao Paulo. It's very good.
Okay. Oh.
They're pretty good. I think you guys went to Sao Paulo.
Yeah.
And you can get like all the tests there, and you can get appointments from one day to another.
Really? Okay.
It's pretty fast. And when you actually get it, you have to pay a fee. The classic program, it costs like $100 monthly. And whenever you need a test or a specialist, you get a fee, but the fee is $20.
And it's like just every time you go to see a specialist or whatever, you pay the fee.
Exactly.
Okay.
And the fee varies. For example, I was in the coast where my new office is based. And I was feeling bad, and that is an endemic zone. Dengue.
Yes.
The dengue is like it's like very common there, and I was feeling bad. Like I had like 4 days like feeling bad. I thought it was COVID, and they were like, that looks like dengue. You should go to the ER room. And people thought like, but you're not in Medellin, so the health insurance is not gonna work perfectly. Like,
so the classic worked all over the country.
35 minutes, and I already have my blood test.
So what does the classic health insurance include?
A specialist. You can go to the Sura clinics. You have to. You can cut the regular clinics that are already packed. You can go to Sura, and you have a lot of specialists just with the fee. You can have blood tests for free. Whatever. If the specialists say like, hey, we need a lot of blood tests or samples. You can go to Sura and it will be for free. And you have very good doctors and very
What
good.
about if you needed like a surgery? Is that also, you don't have to pay like, in the United States, you have to pay like additional to your health insurance. Like you don't have to pay additional for it.
You pay the fee.
It's all included in the fee.
You pay the top fee. And it's like, it's like $20, $35. That's it.
And it's like pretty common to be able to get that surgery very quickly. Like, they like if you need it, but it's not like super urgent. You could plan it within a month, typically.
For example, I had something here like 5 years ago. It was like something that keep up
on your cheek.
Yeah, it was like a small bump, and I went to this dermatologist, and she was like, "Yeah, you need surgery." And I will call now to the insurance company, and if they approve it, I can operate
just do it right now
in a week. And that was it. I mean, it was a small surgery, but I didn't pay. And if I didn't have the insurance policy, it would be like $1.5 million, and I didn't pay nothing.
So if you didn't have the insurance policy, those kind of surgeries would cost money.
If you want to do it with a private doctor.
Oh, I see, with the private doctor. Oh, okay, it makes sense.
If you go with the EPS, you get the surgery, but in 6 months.
Right. But if you want a private doctor, you have to pay. So because you have the health insurance, you didn't have to do that.
Exactly. You will pay the small fee.
Okay.
It's like nothing compared to the surgery.
Right.
I know there are some treatments that are very expensive, but the fee will be $100.
Minimal.
Exactly. So it won't be the comparison. It will be like more than 7-10 times the value of the actual intervention. So it's always the best option. Like you won't pay.
So what about for people who have like So people who have like a deviated septum, do you know what that is?
No.
It's like people who have nose issues, that can't breathe very well, and you go get surgery. And it's not necessarily like a cosmetic surgery, right? But you can redo your nose at the same time if you wanted to. But a lot of people go, is that because that's like an elective surgery? You don't necessarily need to do that. I mean, some people do, but let's say you don't need like it for your safety of your health, but you will breathe better if you do it. Can you do those elective surgeries through the classic plan?
I did it. I mean, I got to the point that, well, the doctor that I got into the directory, and that is the beauty of it, because you get the directory, and I have problem because I have that.
The deviated septum.
This is the good one, and it doesn't it doesn't work, right? This one is like just aesthetic.
Yes.
It's just there, but it doesn't do nothing. So this one is the good one, and it doesn't work. And I just got like five surgeons, like nose surgeons, otorrinolaryngology. I don't know the name in English, but it's otorrino is the name here. Mm-hmm. And I call like the first three that I searched in the directory, and the first one had agenda for a month and a half. The second one like 3 months. But the third one was like 2 weeks. For all of that, I only pay 75 mil, 50 for her, the fee for her.
Yes, the fee for her.
And the 25 for the fee for
the X-ray thing, or like
the thing that they go to your house, they connect you, you just sleep in your house with that, and they come like at 6 a.m. just take it out, and those are the results. After that, they had to make a test, like. They put like a camera
down your nose, yeah.
That hurt.
Gosh, that sounds horrible.
I mean, this one was like, and when he saw this it's gonna hurt, I can already feel it, and it hurt a lot.
And it hurt.
But
it was all included.
Exactly, that was the 25 mil.
What?
Because it was the health insurance. Because I already pay $100 monthly, right?
Right.
And at the end, she was like, "Look, you have the deviation,
yeah,
but it's like minimum stuff. For me to get there and correct that, I will have to make a massive destruction just to do that.
Right.
So my suggestion is just try with this oxygen mask, and if
it gets worse, or if there's something.
Okay, let's reevaluate. But my suggestion is don't do it now.
Interesting. Yeah.
And my wife was there, and she was like, "What about the surgery? How much would it cost?" And she was like, "No, it's only the fee. You just have to."